Menopause can have a huge impact on women's mental health. Let me give you a couple of examples. So I had a friend who was always a little bit anxious, but one summer in her mid-40s, her anxiety just exploded. She went from being a little bit of a worrier to barely functioning. She couldn't sit still in church anymore. Her whole body shook with anxiety, and she would pace the halls in these anxious, shaky circles. So why did her anxiety become so extreme? Before I take a stab at that, let me share another example. Mel Robbins is a best-selling author, a life coach, and a YouTuber, and Mel posted a video about anxiety where a middle-aged woman approaches Mel at a book signing. And in tears, this woman asks Mel what to do about panic attacks. Now, Mel, who I respect, has had panic attacks her whole life, and she quickly jumps in with a quick psychological solution. But she missed something. This woman said, "This is new to me." Now, when you get a new symptom, something that you haven't had previously in your life, we've got to ask the question, what has changed biologically? Because I bet you, my friend, and this woman on the video, both of whom are middle-aged, were not connecting their new anxiety levels to the whole body changes that come with menopause. So we've got to check that, because in addition to good psychological advice, women can also benefit from some menopause-informed medical care. Now, don't get me wrong, both are important, but the menopause treatment is often the one that gets missed. So that's what we're going to talk about today. Menopause can really impact mental health, but there are effective treatments. You don't just have to grit your way through it. So let's talk about it. And I'm excited to have a menopause expert, Dr. Mary Claire Haber, here to share the medical aspect of it. I just want to jump right in. How does menopause impact mental health? I know a lot of people who seem to be functioning pretty well in life, doing okay, and then in their 40s, 50s, they start having these new mental health symptoms or more severe mental health symptoms.
Coming from the medical end, it's well documented in the literature. We have multiple studies showing new onset of mental health disorders throughout the menopause transition, especially in perimenopause, or exacerbation of a pre-existing condition that was probably well controlled with maybe medication therapy. Suddenly your resilience decreases.
Yeah.
Why that happens is like anything in life, there's multiple reasons. And so one is that as estradiol is a really powerful hormone that has receptors throughout our whole body, but especially in the brain. And when we lose that estrogen level, the receptors stop functioning because there's nothing binding to them. We see an increase in neuroinflammation. We see the receptor sites starting for serotonin and dopamine and norepinephrine and all the things that make our brains go, don't function as well. And the way that manifests for a huge amount of women is mental health disorders, anxiety, depression, and functional disorders like ADHD, and on that spectrum as well.
Interesting. Are those changes in the receptors, are those permanent?
No. So studies have shown you can upregulate the receptors again if you give them back estrogen.
And we are going to go into treatment options, including hormone replacement therapy. We're going to do that in just a minute. But first, menopause is not just hot flashes. It's not just the end of your period. It's a process that leads to changes throughout your entire body. Perimenopause begins 7 to 10 years before your period stops. So you can start to see changes in your entire body, in your sleep, in your mental health as early as your mid-30s due to menopause. We start having a decline in estrogen and progesterone, and estrogen has been shown to have a modulating effect on mood-regulating transmitters like serotonin and dopamine. And so when we decrease our estrogen levels, that's going to make us more vulnerable to stress. So it's really common to see, especially in perimenopause, symptoms like depression, anxiety. A lot of women experience more worry and restlessness and physical symptoms like heart palpitations. And that can lead to more symptoms of panic disorder and irritability. Hormonal changes can make a lot of women more prone to mood swings and frustration, and that could affect their interactions with others. It's also common for women to experience difficulty sleeping, insomnia, night sweats, or early morning awakening, and all of that can contribute to more irritability, and that takes us also to brain fog. So some women experience memory lapses and difficulty concentrating during menopause, and that can be really frustrating. And this is all in addition to the common things people think about when it comes to menopause, like hot flashes, night sweats, and metabolism changes, which can make your body change quickly in energy levels and contribute to weight gain. All of this, from lack of sleep to physical symptoms that can impact your self-esteem and your relationships and clearly your mental health. Now, fortunately, you don't have to just suffer. There are effective treatments, and we're going to get into those. But first, though, let's just address one other issue associated with women's health that has to do with menopause, and that's gaslighting. When it comes to women's health generally, and especially understanding the shift into menopause, awareness, education, and even medical support are lacking. Women get gaslit all the time, even by their doctors. They get told to just deal with it, or their symptoms are dismissed as, oh, just anxiety or just menopause, without giving them like a single effective strategy to deal with it. Now, going through menopause is confusing enough, but when doctors don't listen to you, or they downplay your symptoms, or you're the one who has to take your research to them and they're not willing to listen, trying to get the support that you need can be really hard. Now, I'm not going to rant here, even though I want to, but women's health issues have often been downplayed. So it's just really important that you spend time learning about menopause on your own and then find a provider who's skilled at treating menopause. And then just be prepared that you're going to have to advocate for the treatment that you deserve because there are effective treatments. Okay, so that being said, let's talk about the 4 main things you can do to help with symptoms of menopause and to stay healthy through those transition years. So there are 4 things: hormone replacement therapy, nutrition, sleep, and exercise. Now, Dr. Haver helped me understand her first recommendation, which is hormone replacement therapy. Here's what she says about how HRT can lead to benefits in many areas, including mental health. Naturally takes me to the question, does hormone replacement help with that? Is that one of the best treatments?
So we know that in women who were treated starting in perimenopause with hormone therapy versus the same kind of group of matched women who were not given, offered, or accepted hormone therapy, the chances of a new onset of mental health disorder is higher in the untreated population. This moment, the guidelines are not suggesting hormone therapy as a primary treatment option for mental health disorders. They are still recommending SSRIs and SNRIs and therapeutic approaches, but they are saying that it can be a really powerful adjuvant therapy, especially if she's not responding to an SSRI.
And I know that a lot of people have concerns about HRT, especially since a study 20 years ago made headlines saying that it causes breast cancer. Now, I asked Dr. Haver about these concerns, and we ended up having a much longer conversation on this topic. You can check out the entire conversation on my podcast, but the summary is, all medications come with some risks. The added risk of breast cancer is actually very, very low. For most people, HRT is a safe option, and its pros outweigh its cons. But of course, work with your individual provider, work with a skilled doctor who can help you make the right decision for you. Here's a bit more of what Dr. Haver said.
What people need to understand is what we're treating, right? And so we're not just treating hot flashes. We need to get, when am I through menopause, or my menopause only lasted for so long? We don't define menopause by the presence or absence of a hot flash. We define menopause as from ovarian dysfunction, like your ovarian failure, till you die. That is menopausal status.
Okay.
And that's a paradigm shift in the way people think about things. It's more than just a bothersome hot flash. It is a turning point in your life where this of estrogen is going to affect your brain, your bones, your genital urinary system, your skin, your lung, your kidneys, your eyes, every organ system is affected. And by replacing, it's like thyroid hormone or any other hormone. If you had an organ that failed and your pancreas, type 1 diabetes, perfect example. If I didn't, you'll die without insulin. But if I don't replace your hormones that you're missing, you're not going to live as long a healthy life or have as good a quality of life. You're going to die sooner. You're most likely going to have osteoporotic fracture. The list goes on and on.
That being said, basically your ovaries stop working in middle age.
Yeah.
Is the treatment, like you would say, yeah, let's continue to do hormone replacement for the rest of your life?
Yes, as long as for that individual patient, for her, the benefits outweigh the risk, which is probably the majority of patients, at least most of mine,
Yeah.
we can safely keep her on hormone therapy for the rest of her life, as long as she wants to keep taking it.
Because of all the benefits to all the body systems.
Yeah.
Interesting. Yeah. And when people really look at the risks and the benefits, usually generally strongly outweigh.
Yeah. Especially when you count in the things that you don't notice, your cholesterol, your triglycerides, your blood pressure, all of that responds to hormone replacement therapies.
So consider HRT as a good treatment option. Talk to your doctor about it, but it isn't our only option. When we consider that mental health stems from physical health, it includes how we take care of our body in other ways. Dr. Haver and I also talked about nutrition being a big factor for both physical and mental health during middle age. There are 3 aspects to how we feed and fuel our bodies that help manage the effects of perimenopause and menopause. So let's first look at anti-inflammatory nutrition.
So loading up on things that naturally fight inflammation, omega-3 fatty acids, so important in brain health. Things with anthocyanins and natural flavonols and fruits, vegetables, legumes, seeds, nuts. It's all in my shake right here. And then really looking at what things for you cause inflammation, like doing a deep dive into your own nutrition. It might be dairy, it might be whatever. And then avoiding the things we know universally can cause inflammation in high amounts. So most humans can tolerate, our guts are meant to tolerate a lot of stuff. And we can tolerate here and there things, but people who are hardcore going in processed foods every single day, 2 meals a day, the markers have been done. Their inflammatory markers are higher, and those are getting to our brains.
The second thing is intermittent fasting. What Dr. Haver recommends is eating during an 8-hour window during the day and then fasting for 16 hours. So, for example, you could eat from 10 a.m. to 6 p.m. and then fast from 6 p.m. to 10 a.m. the next day. And this can help with metabolism, weight gain, inflammation, and it can improve our cells' resilience. And for some people, it can improve their blood sugar. But as always, I encourage you to work with your doctor before making these changes. Okay, and then third, we're going to explore your micronutrients and consider supplements.
It's really looking at your macro and micronutrients. How's your magnesium? That's a huge mental health. What's your vitamin D? We can't function without adequate vitamin D. And 80%, 85% of my patients in clinic, I ran the numbers, are horribly deficient in vitamin D. Everyone on a supplement. And fiber, how much fiber are you getting? I preach fiber all day long, but getting your fiber from food, because guess what? Those foods also have vitamins, minerals, nutrients, and other things you need to be healthy.
Dr. Haver also recommends some other supplements, including turmeric, collagen, omega fatty acids, vitamin D and K combined. Now, figuring out the right supplements for you might require careful work with an understanding doctor and probably some blood tests and most likely a little bit of experimentation. But there's evidence that deficits in some of these nutrients affects brain health and overall health, and that supplementing can improve mental health and physical health. Okay, so as we look at mental health as women move into perimenopause and menopause, it's important to remember a few things. So first off, this is probably impacting you sooner than you realize, 7 to 10 years before your period ends. And perimenopause is actually when we see most of the mental health impacts. Hormone replacement therapy, in addition to SSRIs, which are antidepressants, can be an effective way to decrease symptoms and also protect other organs. And along with sleep and exercise, nutrition is vital in maintaining mental and physical health through the lifespan. I have a lot of videos about these topics on my channel and in my courses. So if you'd like more information, feel free to check those out. I'll put a link to some of those in the description. Now, we are so used to hearing women and men complain about the effects of menopause, but menopause isn't just a bad thing that we suffer through. It's a developmental change that comes with benefits too. For one, there's no more periods and no more birth control. Menopause also marks a transition in life where women may have more time or energy to focus on their own interests or careers or hobbies or personal growth, because they might not be dealing with the demands of younger children anymore. As my brilliant friend and editor says, menopause doesn't give us more time. Being an empty nester does that. What perimenopause and menopause do, which has been powerful to me, is to call loudly for women to think about their own health and care again. It turns out to be a little gift in between the years of sacrificing so much for their children and sacrificing a lot as they care for elderly parents. It's kind of beautiful how our bodies say, for a few years, pay attention to what's going on here. Take a season to recuperate and regenerate. And, menopause is also a chance to explore your own identity. Another good thing about menopause is that it often comes with emotional stability after menopause, and that can lead to more harmonious relationships as your mood swings or your hormonal fluctuations decrease. Another thing that's interesting about menopause is that many women become more confident, more direct, or more assertive. Dr. Haber even said,
"My ability to tolerate other people's BS and alcohol have completely disintegrated."
Okay, I hope that's helpful. Menopause comes with challenges to mental and physical health, but also some cool positive changes as well. It's a life transition that you can't avoid, but it is something that you can grow through. You can develop the ability to get more real with people, to explore your true self and values. It gives you a chance to evaluate your life path and make sure that you're passionately pursuing the course you want to be on. And for a lot of women, they stop caring as much about what everyone else thinks, and they can just really focus on being their best authentic self. Good luck, everyone, and take care.